Greetings, my name is Victor Manje from HBMS Uganda in partnership with HBMS TV, coming in with the medical news. The very first question that you could be asking yourself, why the medical news? Why has HBMS TV come up with this program, medical news? It's because of the various reasons that we are facing here in society today concerning non-communicable diseases. Very many people put emphasis on the communicable diseases, coronavirus disease, HIV, which is very good. However, the non-communicable diseases tend to be neglected. Talk about cancers, hypertension, diabetes, very many other non-communicable diseases that very many people suffer from, even at times because they don't know what causes them, they don't know how to avoid them, they don't know the measures they can take, maybe to control them or to have relief of such diseases. That's why we have come up with this program, special program that is designed. It's going to be taking place every Saturday. That's East African time. Every Saturday we are going to be having that program streaming live on our YouTube channel. And that's the main emphasis that we're going to be having, focusing on the non-communicable diseases, because we want us to live a healthy life and a happy life. Not only us, but even other family members of ours, other friends of ours, and even other relatives that we have. That's why we've come up with that special program. From HBMS TV, and today we bring you yet another topic that we are looking at in our medical news. That's the cause of non-communicable diseases. Why this area? This is because, as you know, for the communicable diseases, we know the cause. We know that for COVID-19, it is caused by a virus. For HIV, it is caused by a virus. If it's cough is caused by bacteria. Unlike these non-communicable diseases, for them, they do not have a particular cause. However, they do have what we refer to as factors or predisposing factors. Now, these put us at a great risk of suffering from these non-communicable diseases. For example, the lifestyle, the way we live our lives, the cosmetics we use, the chemicals we use. For example, the ladies use lipstick. I know you know about the deodorants that we use, the lotions. Now, all these chemicals accumulate in our bodies. They cause toxins in our bodies. And once these toxins accumulate in the body, we tend to get these diseases. That's why we have very many increasing cases of cancer. Secondly, is the environment that we live in. Now, concerning the environment we live in, this is very much characterized with pollution, especially water pollution, air pollution. For the air pollution, it is so rampant that each and every person has a car, and every person that has a car, they tend to, as the car moves, we tend to get very many exhaust fumes. Now, from the exhaust fumes, they go and they accumulate in the atmosphere, and you breathe them in. Once you take in those exhaust fumes, you tend to accumulate toxins still in the body, and that also puts us at a great risk of generating very many diseases that we refer to as non-communicable diseases. Thirdly, is the diet that we have to put in, the food that we eat. Of late, very many people happen to feed on what we refer to as processed food. Very many processed foods. At times, it's even unavoidable. Very many people can't avoid taking in processed foods, the chips and all that. What does that lead us to? We tend to miss out on the natural food. And once you miss out on the natural food, you put yourself at a risk in that you miss out on those very great nutrients that your body needs to fight and even prevent these diseases that are non-communicable, that come from within the body. Number 4 is the stress factor. Now, stress is It's one thing that very many of us undermine, because it is hard for you to know that you have stress. You cannot tell that you have stress, but once you have stress, your body is going to respond in a way of producing hormones. And once these hormones are very much in the body, they tend to accumulate and they become toxic. So you tend to be with very many toxins in your body. And remember, once you have toxins in the body and the body cannot put out these toxins, you're going to still generate non-communicable diseases. That causes cancers, it causes hypertension, it causes diabetes, and even very, very many other non-communicable diseases. And lastly is the medicine that we take in. Usually the pharmaceutical medicine that we take in, it has a healing effect of just 70%, which means the other 30% is side effect. And 30% of side effects, that means that you are going to have these side effects accumulating in your body. That effect is going to accumulate, and over time, you're going to have issues with your liver, you're going to have issues with your pancreas, and that leads to diabetes, and that will also lead to very many other non-communicable diseases. So you and I should keep keen. We should always make sure that we look at these factors, memorize them, and be in position to avoid them. From HBMS TV. We are back with the medical news, and today we are going to be looking at diabetes. Diabetes has two types. It has type 1 and type 2. All those are types of diabetes. However, do you know the symptoms of diabetes? There are various symptoms of diabetes, and that includes thirst, frequent urination, blurry vision, means you have problems with your eyesight, excessive sweating, and then also slow healing wounds, among very many others. However, I would like to put a disclaimer. Note that if you have any of these symptoms, it's diabetes that you're suffering with. No, but you need to confirm with the medical doctor so that they can be in position to advise you accordingly. But with us, HBMS Uganda, our main emphasis is to make sure that you're living a healthy life. So what are the control measures? How can you be able to control diabetes, or to even provide relief to that person who is already suffering with the diabetes? The number one cause of diabetes is being overweight and even other predisposing factors. And those are because of our lifestyle. So the number one way of controlling diabetes is by managing our weight. One, through exercising. You have to exercise at least 30 minutes every single day. You sweat for at least 30 minutes each and every single day. That helps to keep you healthy. It promotes a healthy blood flow, and then also helps you to manage the excess weight. Number two is the diet, the way we feed, what we feed on. You know that very many of the foods that we eat, at times they are processed foods. So we should be very keen in as far as our diet is concerned, such that we tend to avoid such diseases, especially diabetes. You have to feed on natural foods. Reduce the quantity of processed foods. And thirdly is supplementing, which is our main way of treatment, especially here at Home-Based Medical Services International. Supplementing. We need various supplements. Those that detoxify the body, full body detox. Those that provide anti-aging programs to our body. You should take care by supplementing, and we have them here at HBMS Uganda. Talk of the C24/7, that's complete nutrition, 24 hours, 7 days a week. It works very much on prevention and even control of the diabetes, both types, type 1 and type B, because it contains all the necessary minerals that are needed in fighting off the diabetes. Talk of the complete phytoenergizer. This is also another food supplement that is very good, especially for a person who has diabetes. Talk about the Live Alkaline Coffee. Now this even comes in a flavor which is sugar-free. This sugar-free coffee contains natural sweeteners. instead of this normal sugar. So you still with it, you're able to fight off the diabetes or even prevent it. And very many other supplements as you are going to keep on seeing. Thank you very much and have the best of your day. Goodbye.